overwhelmed about what will happen next. Here today to talk about that is Dr. Javeed Sakara. He is the Chief of Psychiatry at both the Institute of Living and Hartford Hospital. Dr. Sakara, thanks so much for being with us here today.
Thanks so much for having me.
So what are some of the methods people can actually do to cope with their nerves and anxieties?
Well, at a time like this, it's really acknowledging that what we're experiencing is an extreme stressor. And so it's important that we first start by validating how we're feeling, validating anxiety as something that's normal in the context of a stress. Once we've done that, we should be making space to ensure that we take time to process and deal with that stress rather than continuing full speed ahead as usual. That might look different for different people, but ultimately it's important that we normalize ourselves, our emotions, but also that we might be able to do something about it. And that action, like giving, donating, or contributing to causes related to what's going on can also be helpful.
So let's say that you have a brother or sister or a husband or wife who's really having a tough time. How can you help loved ones through this time?
So it is definitely a difficult time, but there's no one size fits all in terms of how we support and help others. Everybody's going to cope with this type of stress in a different way. And in particular, what's happening in Ukraine is going to trigger people of different generations, of different backgrounds in different ways. It's really important to resist the urge to try to fix the way that someone's feeling, and really important to create space to make sure people know that we're there, we're available, but also not to take up space or push people into feeling like they have to cope with it one way or the other.
You know, also we had news about COVID every single moment, every single day, every single newscast, and now we're talking about the war. What kind of an impact is that having on people?
I think it's having a pretty significant impact. Just when we thought that some of the stress of COVID was lifting, here we are now with a news cycle that's inundating us with very traumatizing, triggering, and stressful images and stories about people suffering, children suffering. So it's taking a toll, and it's very important for everyone to give themselves permission to take breaks from news, to take a pause from that constant stress of what's going on.
And doctor, I imagine this is also stressful on healthcare workers. What are you doing to help each other during this?
So we at Hartford Healthcare are doing everything we can. We've organized a fundraising effort that supports the direct efforts of other organizations. We're also looking into our supply chain and how we can support the much needed supplies over in Ukraine. But at the end of the day, we have to be there for each other as well as for those we serve. And so we are supporting our colleagues. We have colleague resource groups meeting right now. Today we have meetings that are virtual informal support groups for staff. For many of us working in healthcare, watching images of hospitals being bombed create a level of distress that we really want to create the space for staff and providers to be able to talk about. And so we're trying to create that space as best we can.
Dr. Javeed Sakara, Chief of Psychiatry at the Institute of Living, we thank you so much for your insight today and your help on this.
Thanks.